From the station working for you, this is WRTV News at 5:30, streaming now.
Now at 5:30, navigating the pandemic, how one business owner is managing to keep the doors open for now, the difficult decisions weighing heavily, and a creative plan for the future. We could all use a little pampering right now, even the beloved Shara preparing for a big return next week. Lindsay.
Topping our lineup, unemployment claims are rising again. How career experts say you can make the job search more manageable and try to reduce your stress. Thanksgiving is a big challenge for colleges trying to prevent COVID from spreading. The options universities are using to keep students and their families safe before and after the break. There's a unique but largely unrecognized group of people taking care of adults with all sorts of health challenges. We're recognizing Black men who are caregivers, the obstacles they face.
First at 5:30, so many businesses are struggling to stay open, from reducing hours to transitioning to carry out only, and now being open at 50% capacity. The owner of a local cidery says the pandemic has been a roller coaster. WRTV's Nicole Griffin is getting an inside look at the challenges business owners face in order to still say we're open Indy.
The owner here at Ash and Elm Cider Company tells me the new restrictions in place in Marion County aren't really impacting her business because they have remained at 50% capacity since they were able to reopen over the summer. She says right now she is bracing for the winter months. Sales over the last few weeks have already been down.
It's a very delicate balance and one that I find myself thinking about a lot.
Ash and Elm Cider Company is closing in on its 5-year anniversary, but 2020 has been the most difficult year so far, as it has been for many of us.
The hardest thing for us has been wanting to do right by both customers and our employees. And we're a business, so we don't want to put our business at risk, but we also don't want to put our people at risk.
Over the summer, owner Andrea Hamoya says her business survived from customers sitting on the patio, carry-out sales, and distributing their products to local restaurants and liquor stores. But as the weather gets cooler and coronavirus cases rise, the number of people coming into the Eastside Tap Room has decreased.
Trying to figure out, should we just close preemptively and be carry-out only? Can we do that? Can we sustain our business? Because why stay open if people aren't going to come? But also, why close if we don't have to?
I actually heard about Ash and Elm a while ago at a festival, and my parents own Hog Molly Brewing Company in Columbus. We sell 3 of their ciders.
UIndy student Tessa Krempel was the first customer at Ash and Elm Wednesday afternoon. It's her effort to support another local business.
I mean, we have to be physically divided, but doesn't mean we have to be completely divided. And by supporting each other, we say, hey, we're going to get through this together.
Heading into the winter months, with January and February typically being the slowest of the year, Hamoya hopes to see more community support so she can keep her doors open and keep her staff employed through the holidays and into the new year.
We want you to feel safe, and so we're trying to adapt as a business so that people can still support us without, feeling uncomfortable about what they're doing.
Working for you, Nicole Griffin, WRTV.
Ash and Elm is getting creative when it comes to getting their ciders in the hands of their customers while staying socially distant. They are launching a new cider subscription service they hope will help them push through the slow winter months. We have more details on the WRTV News app. Kyle.
Another great November sunset across central Indiana is shaping up for us, and even though those daylight hours are getting a little bit shorter each day, it's not keeping us from warming up thanks to those southwest winds that we had today. 63 degrees for us right now in Indy and Kokomo, 64 in the Bloomington area, but there's that wind, and this is the steady wind, around 20 to 25 miles per hour in many spots, still gusting between 30 and 40 miles per hour. And as we look at that wind gust forecast for us here this evening, this is 8 o'clock and still gusts between about 30 and 40 miles per hour. Gradually, they will taper off, but it's still going to be a breezy night for us. Even as we go into tomorrow morning, we've got those wind gusts around 25 to 30 miles per hour. At least it is still out of that warm southwest direction. So that means temperatures here as we go through tonight, falling back through the 50s to around the upper 40s as we go into tomorrow morning. Not bad at all here, starting off your Friday morning at 49 in Bloomington and Noblesville, 51 degrees. In the Muncie area, we'll talk about one more warm day and your weekend forecast coming up. Lindsay?
The CDC is now urging people not to travel for Thanksgiving. New guidelines out today say the safest way to celebrate is at home with the people you live with. Anyone not there 14 days prior to the holiday doesn't count. That means college students or military members coming home should be treated like a guest with limited contact. If you gather anyway, limit who prepares and serves food, sit outside 6 feet apart, and wear masks as much as possible. The increase in COVID-19 cases we're seeing is stressing the system for testing. We're seeing long lines like these. The companies that make the tests and supplies needed for them are trying to keep up with the demand.
Those companies were operating on an allocation basis, and that just means they're basically everything they make is going out the door. There is no reserve. So if there's an increased demand in a lab for testing, there's no more reagent to be had. So to meet that demand, that lab has to use a different manufacturer's test.
Kelly Robleski is with the Association of Public Health Laboratories. She says along with getting supplies, there's the issue of human resources. There's only so much lab capacity and only so many trained people to provide testing. The American Clinical Laboratory Association says a surge in demand for testing means some labs could reach or exceed their current testing capacities soon. That means it could take longer to get your results back if you get a PCR test. Robleski says PCR results can take anywhere from 24 hours to a week right now. With antigen tests, you get the results back in less than 30 minutes. The supply of those tests is good now, but not everyone offers them. Both lab groups stress testing is important, but you have to be strategic about it.
There's been a lot of emphasis put on testing, but testing is only one piece of the puzzle. It gives you some information, and if you're not going to do anything with that information, whether it be targeted closures, whether it be staying home and isolating, we're not going to stop spread of disease.
As far as getting more tests, well, it's going to take a while. She says it takes 6 months or more to significantly increase production capability. Labs don't expect to see the ramp up in supplies until the first part of 2021. Next in our lineup, unemployment claims, they're rising again. There are concerns about the mental toll this is starting to have on people who have been out of work for weeks. How career experts say you can make the job search more manageable and try to reduce your stress.
Late this afternoon, a federal judge halted the execution set to take place at the federal prison in Terre Haute this evening. Orlando Hall was convicted of kidnapping and raping a 16-year-old Texas girl, then bludgeoning her with a shovel before burying her alive. He was set to die by lethal injection at 6 o'clock. No word yet on what comes next. Hall was due to be the 8th inmate executed this year as part of the Trump administration's resumption of federal executions after a pause of nearly 2 decades.
The latest numbers from the Labor Department show 742,000 Americans filed for first-time unemployment benefits last week. More than 320,000 workers filed under the Pandemic Unemployment Assistance Program. Both of those numbers are up from the previous week. More than half of those unemployed right now worked in low-wage jobs, despite making up less than a quarter of the workforce. And that means the highest-earning industries are recovering faster. Experts are concerned that people who are unemployed are suffering more mentally. We talked to a professor of economics who has studied the psychology of unemployment. He tells us some people become more emotionally distressed by losing their job. Those who don't have a financial buffer, have young kids, or are minorities can feel like they're less likely to be rehired. Unemployed people are normally optimistic at first, but after 5 or 6 weeks, feelings of hopelessness or anxiety increase.
That's when I would say that psychological distress really arises, and poor emotional well-being starts to become a footprint of that bout of unemployment.
That's concerning because, as the director of the New Start Career Network points out, the number of those unemployed long-term has ballooned during the pandemic. Combining the stress of the health emergency with the stress of being unemployed just compounds an already difficult process.
You know, your self-esteem can take a beating if you apply for jobs and get a series of rejections and you don't know why, or maybe you don't hear anything. You know, so even pre-pandemic, we know how stressful it is.
The center suggests breaking up your job search and related goals into small, manageable steps, like redoing your resume or building your online presence in chunks. Find activities that reduce stress, and while looking for full-time employment, consider part-time or gig work. That's because it's easier to find a job when you already have one. The center is also partnering with the Mental Health Association of New Jersey to offer online health and wellness workshops. More in our lineup. Thanksgiving is a big challenge for colleges trying to prevent COVID from spreading. The options the universities are using to keep students and their families safe before and after the break. We're all thinking of healthcare workers as this new surge of coronavirus spreads across the country. Dan Grossman talked with two of them who treat COVID patients daily, and they say they're using what they learned in March, April, and May to better treat people.
If there is anyone to help navigate the uncertainty hospitals have faced since spring,
it has been very busy, and it has really, as you mentioned, gone up in the last 2 weeks.
Dr. Julia Limes is it.
My second year of residency was the Aurora Theater shooting, and I was the ICU resident that night.
That night, she helped manage the response to a disaster that forced police officers to use their patrol cars as ambulances when a gunman killed 12 people at a movie theater in Colorado and injured 70 more. An unprecedented situation that has brought clarity to the one she finds herself in now.
We have started deploying people from other parts of the hospital to come and help us on both the COVID floors and the COVID ICU.
Across the country, hospitalizations from COVID-19 are rising fast.
We've already surpassed the numbers from the first surge, so we're kind of like, okay, what's next?
For critical care nurses like Maddie Smith, the fear, stress, unpredictability might have consumed her once more if it wasn't for the lessons learned in this very COVID unit you see before you.
We just know how to treat them better, and we know when to intervene, like sooner versus later with, different interventions. So that's been really helpful.
Because of the dangerous nature of what is in here, the hospital shot this video for us. It shows the practice of undeniable strides that have been made in hospitals since March. Medications to treat COVID symptoms are available. Vaccines are being developed with remarkable effectiveness. And the arc of how a patient might respond to symptoms is now better known.
It's easier and it's smoother than it was in the spring.
Dr. Lime says it allows them to manage bed space better and adds a critical element to care. Composure that can be seen in how patients are treated and how these first responders treat themselves.
It was hard. I think the biggest part that got to all of us was that these people, they don't have family to be with. That first surge, it all hit us pretty hard because of the sadness that, what happened down here. We just kind of leaned on each other and got through it. But it was tough.
How far this current wave will go is unknown, but by drawing from the past, these first responders know they'll be ready to deal with it, no matter what is thrown their way.
We just have a better sense of the trajectory, and that is hugely valuable, I think, as we go into this next surge.
I'm Dan Grossman reporting.
So many holiday traditions are canceled this year, but not the mysterious return of the bronze cherub on the Ayers clock downtown. The cherub is set to return next week, the night before Thanksgiving, just as it has for more than 70 years. But in the meantime, while it's perched, meaning the clock has been undergoing restoration, the cherub has been getting a little buffed up too, sort of a spa treatment. Indiana lawmakers shared this video of the facelift with us. When the cherub returns, it will be shinier and cleaner than ever. So when you go downtown over the holidays, be sure and look up at Washington and Meridian to see the shiny 3-foot-tall angel. Kyle.
And the cherub, the ultimate social distancer, isn't it? All right. Well, as we go through the weekend, we've got some changes that are coming our way. You can see right now, we've got some clouds that are rolling through, and that'll be the first line of changes that we notice. Temperatures today made their way into the lower and middle 60s. Really didn't feel very mid-November-like out there, but that's okay. 64 in Muncie right now, 66 degrees in Lafayette, and in the upper 50s in Columbus. Around Indianapolis, find New Pal in the upper 50s. You got 62 in Castleton and Fishers. Those winds still out of the south and southwest here, and they're gusting some areas still between about 30 and 40 miles per hour. 37 mile per hour gust here in Indianapolis. But with sunset now, I think the winds will taper a little bit. Shouldn't be an issue really for the kids as they head off to the school there. We'll have occasional gusts around 20 to 25 miles per hour in the morning. Mild temperature of 51. We'll get back into the lower 60s for one more day here. A high temperature of 62 in Bloomington, 63 in Muncie and Columbus. Again, the average high is only around 50 degrees. So we're talking about being numbers here that are about 15 degrees above average. That changes though. Saturday, Sunday, we're back around where we should be, and we actually fall below average heading into Monday. And it's going to come with some rain here for the weekend. Chance for a few showers, mainly along and south of I-70 on Saturday. Then as we get into Saturday night and Sunday, some more widespread rain across the area. Could see about 3/4 to an inch of wet weather. Here's your 7-day planning forecast as we look ahead to the week of Thanksgiving. We've got cool temperatures on Monday, but looking pretty good by Thanksgiving itself, dry and 54.
As the Thanksgiving holiday approaches, college campuses across the country will empty out. Tens of thousands of students will head home for the break, and public health experts fear mass travel and indoor gatherings could spark super spreading of the coronavirus. Usher Qureshi takes a look at how some universities are preparing.
Within days of returning to campus this fall, Brianna DeWall contracted the coronavirus.
We went out to a party and all my friends got it. So we're assuming someone at that party had it and didn't know.
The return to college campuses in August and September coincided with a 55% increase nationally of COVID cases in young adults ages 18 to 22. Next week, DeWall's headed home for the holidays, but plans to get tested before she travels.
I will be flying, so I feel like that's a precaution I should take.
While her school isn't requiring mandatory exit testing, other schools are. Penn State is offering free voluntary exit tests. The University of Michigan has made exit testing mandatory, and New York State's university system is also mandating a negative test result for all of its students before they leave campus.
Some people may get a test. That's not going to decrease the risk to zero, but it is going to decrease the risk substantially.
Dr. Amish Adalja is a senior scholar with the Johns Hopkins Center for Health Security. He warns that without extra precautions like frequent testing, mask wearing, social distancing, and self-quarantining ahead of the holiday, the risk of community spread is high.
It is going to be a major challenge when you have your student body move from campus back home and then come back on campus, because that's likely to introduce more levels of infection.
Earlier this year, researchers tracking 7.5 million students at more than 1,300 universities concluded that thousands of college students may have picked up COVID-19 while at densely packed spring break destinations, only to return to infect others with the virus. Some schools like DeWall's are not having students return to campus until January and have canceled spring break. But once again, testing is voluntary.
I think we should have to get tested before we come back, and I think it's very careless that they aren't requiring us to get tested before we go home.
The CDC hasn't issued any specific COVID guidance on colleges and break, and while the American College Health Association encourages testing, it stops short of calling for it to be mandatory.
And colleges, we know, have been hotspots for infection, especially with off-campus activity, so I do think this is going to be particularly challenging to accomplish.
I'm Usher Qureshi reporting.
The FDA says it will start giving weekly updates on any outbreaks of foodborne illnesses. That's a big change because before this, Americans have had to wait for public health advisories or recalls for food products. The FDA hopes the new reports will allow the public to learn about the outbreaks earlier and more frequently. The CDC recently updated its diabetes surveillance system. That's a database that helps public health experts and doctors find certain information about diabetes in their communities. The CDC has now added 15 social vulnerability variables to the database. That includes information about poverty, education, and access to care, and healthy food, among other factors.
So if we can really see exactly where those communities are, we can have programs at the city level, even the community level or the state level, that try to make it more possible to have more parks, more walkable sidewalks, and that can be a major factor in effectively managing and treating diabetes.
Differences in healthcare access, along with racial, ethnic, and socioeconomic status, may increase the risk of type 2 diabetes. Finally, in our lineup, there's a unique but largely unrecognized group of people taking care of adults with all sorts of health challenges. We're recognizing Black men who are caregivers, the obstacles they face, and a touching fact about them that deserves attention. Racial disparities and bias in healthcare can be a double whammy for multi-generational families of color, specifically when Black men are the caregivers.
We tend to think of the male caregiver as that individual that comes helicoptering in and, pays the bills or may take care of yard work, but that's not all that male family caregivers do.
AARP is putting the spotlight on this sort of unrecognized group of caregivers. Through research, the group found there are nearly 3 million African-American men taking care of an adult family member or non-relative, usually someone with memory, emotional, or mental health conditions. Conversations with these caregivers reveal unique challenges and stereotypes they face, like healthcare bias.
If he is going into a situation with an understanding that there may be a bias, when we talk about higher levels of stress, that would be one thing that could cause more stress for an African-American male caregiver.
And adding to that stress, it's also revealed that Black men are less likely to ask for help. They are often still working essential jobs, facing financial impacts due to tough choices about balancing their career with their caregiving responsibility, even more so now with COVID and the risk of bringing it to a loved one. But they are some of the most dedicated people. A majority of African-American caregivers find a sense of purpose or meaning in that role more so than other caregivers. AARP asks providers and community-based organizations to look at these people as individuals.
Increasingly, male family caregivers are bathing their mothers. That's a difficult thing. And so as a provider, are you talking to that male caregiver about what that may mean to them emotionally?
All right, take a picture of your screen. AARP has a caregiving support line. Its Caregiving in the U.S. report also highlights other ethnic and unique caregivers, everyone from students to those living in rural areas. As we inch closer to having a COVID vaccine, people are asking the question, can someone be required to get it?
The problem with mandates is that many times people do not like other individuals telling them what they need or they don't need to do.
Tomorrow, whether a vaccine requirement could really be enforced.
And we still have a bit of a roller coaster ride with those temperatures over the next 7 days. Will be mild tomorrow at 63, but around 50 here heading into the weekend with rain chances Saturday and Sunday. And right now, Thanksgiving looking pretty good at 54. Thanks for joining us here at 5:30.